Hi, my name's Rachel and I'm one of the Rheumatology Specialist nurses. You've been asked to watch this as we're starting you on Methotrexate injections. Methotrexate is used to treat conditions such as rheumatoid arthritis, psoriasis, Crohn's disease and other autoimmune disorders. Methotrexate may increase the risk of some illnesses being reactivated if you have come into contact with them. So before starting treatment, you will have a chest x-ray and blood tests to check if you've ever been exposed to HIV or hepatitis. We will check your x-ray and blood test results before you start treatment and will ask you about the conditions I have just mentioned. We prescribe the first 8 weeks of methotrexate and your GP will continue to prescribe after that. Methotrexate injections come in a pen, which is pre-filled and designed for easier, more accurate injections. The pens are taken once a week on the same day each week. Never take extra doses. Folic acid is taken to reduce the side effects of methotrexate. You may be prescribed this once a week or more often, but it is not to be taken on the same day as methotrexate. You will need regular blood tests to check your liver function and blood count. Please check your clinic letter for details of these blood tests and when they need to be done. It is your responsibility to arrange the blood test appointments at your GP surgery. Before giving your injection, wash your hands thoroughly. The injection should be given in the thigh or the abdomen, away from the belly button. Rotate the injection sites each week to prevent skin irritation. Make sure the injection site is clean. Remove the cap from the injection pen. Place the pen flat against the skin at the chosen site. You will hear a click. Hold for about 5 to 10 seconds to ensure full medication delivery. Remove the pen and dispose of it safely in a sharps container. Common side effects include mild nausea, fatigue, headache, mild redness at the injection site. These side effects usually improve with time. Drinking water and taking folic acid can help. If you experience more serious side effects, such as mouth sores, severe fatigue, shortness of breath, dry cough, a temperature or signs of infection, you should seek medical advice or contact the Rheumatology Advice Line. There is also an app or an interactive form on our website that you can use if you prefer. We recommend patients who are taking methotrexate to avoid alcohol on the day of methotrexate, to drink no more than 14 units of alcohol a week spread throughout the week. If you have any symptoms of infection, such as diarrhea, a cold, sore throat or a fever, or you're taking antibiotics, you should stop the methotrexate until you're feeling better and the infection is resolved. If you come into contact with someone who has chickenpox or shingles, you will need to get a blood test at your GP surgery to check your immunity. You should contact us and we will arrange this. If you develop symptoms of chickenpox or shingles, you must stop methotrexate and seek medical attention for antiviral treatment without delay. We recommend that you have the one-off pneumococcal vaccine and the flu and COVID vaccines. If you're over 50, then you will qualify to have the shingles vaccine. While you're on methotrexate, you should avoid live vaccines, and there is a small risk that you could get unwell from the vaccination. Live vaccines are usually ones that you need for travel, so if you do need travel vaccines, then check with the nurse who is giving them to you that you're not having the live version. Regarding surgery or major dental procedures, I advise you to inform your surgeon or dentist that you are taking methotrexate. For most minor procedures, methotrexate can be continued. For major surgery, extensive dental work, or in the event of a serious infection, it may need to be withheld temporarily. This should be discussed with the rheumatology team in advance. If you are in an accident or an emergency, you can have a procedure without holding your methotrexate, but you would have a slightly increased risk of infection. Thank you for watching this.